Hello, welcome to the question and answer session on prior authorization of certain hospital outpatient services exemption process. My name is Mary Sue Gardner, and I'm with WPS Government Health Administrators. I'm joined today by Stephanie Boucher from National Government Services.
Hi, good afternoon, everybody.
As well as Diane Hess from Novitas Solution.
Hello.
And finally, Robert Lewis from First Coast Service Option.
Everyone.
We represent all Medicare Administrative Contractors, otherwise known as MACs. The ABMAC Prior Authorization Workgroup developed this question and answer document. This joint effort ensures consistent communication and education throughout the nation. The goal of this question and answer session is to help our provider communities gain a better understanding of the prior authorization exemption process. We hope you find this educational event helpful. So Robert, I received a letter stating that I am starting exemption. What do I do now?
Well, PARs should not be submitted and will be rejected during the exemption cycle. Claims submitted while on exemption will not require a unique tracking number, or UTN. Please follow the instructions on the exemption notification letter.
And Diane, if an exempt provider submits a prior authorization request on 12/21, but it is not affirmed, and the provider then becomes exempt on 1/1, does the provider need to resubmit the prior authorization request? And will the resubmission reject if it is past the exemption start date?
Well, you do not need to resubmit if the procedure is performed after the start date of the exemption period. Now, if you resubmit the PAR after the 1/1, it will be rejected.
And Steph, does the exemption process exempt providers from all outpatient department prior authorization services?
Yes, so if you receive a notice of exemption, it applies to all services under the Hospital Outpatient Department Prior Authorization Program.
And Robert, how many days notice will I receive before I switch from prior authorization request submission to the exemption cycle?
Medicare Administrative Contractors will provide a 60-day notice prior to any transition period, continuation, or withdrawal from exemption.
Diane, why are my prior authorization requests being rejected while on exemption?
PARs are not required while a provider is on exemption. Therefore, any PAR that is submitted will be returned with a rejection decision. Also, PARs should not be submitted for the purpose of obtaining a rejection letter for medical record keeping.
And Steph, how do I bill prior authorization claims without a unique tracking number or UTN during the exemption period?
Prior authorization services that were performed during the exemption period should follow the same billing practices used prior to the implementation of the prior authorization program. Applying previously used or invalid unique tracking numbers will delay processing of your claim.
And Robert, towards the end of the exemption cycle, the MAC conducts a 10-claim post-payment review. How were the claims selected?
The 10-claim sample is based on claim dates of service during the exemption period. This means that the claim selected will be from the time frame in which you were exempt.
Diane, what are ADRs?
Additional documentation requests, or ADRs, they are issued based upon a claim submitted to your MAC. The ADR is going to specify the beneficiary, the service, and the data service and include a list of suggested documentation for the particular service to submit back to your MAC that's going to support the payment of your claim.
And Steph, what is the ADR timeline?
The first ADR letter for exempt providers will be sent on August 1st, 2022. The provider has 45 days to submit the documentation, and the MAC has 45 days to review the documentation and make a determination. By November 2nd of each year, notification of continuation or withdrawal will be sent out to providers. If a provider achieved a greater than 90% claim approval rate, they will continue exemption. Withdrawal from exemption will occur if providers did not meet the 90% claim approval rate. Withdrawn providers may start to submit prior authorization requests on December 18th for dates of service on or after January 1st.
And finally, Robert, what does it mean to opt out of exemption?
CMS has established a rule that allows providers to remain in the standard cycle and continue to submit PARs. Providers will receive a notice of exemption if they achieved a greater than 90% PAR affirmation rate. An opt-out form will be included with the exemption notification letter. The form must be submitted to the MAC by November 30th. Late requests will be rejected.
Thank you, everyone. This video covers the most commonly asked questions all MACs have received regarding the hospital outpatient prior authorization exemption process. If you have additional questions regarding the exemption process, please refer to your MAC's website or customer service number. We want to thank you for your time and have a good day.